For many, many years, people have come and seen us here at Mount Eden Chiropractic because of headaches, specifically headaches because of the greater occipital nerve. So what I thought I'd do today is just explain a little bit about the anatomy of these upper neck headaches and one of the ways we analyse and correct them. So what I've got here is a little picture of the upper part of your neck, and we refer to this bone here as C2 or cervical 2. This next one is cervical 1, and then it borders this thing called the occiput, which is the back of your skull through here. All right, so to look at it on the model, looking at it from behind, this is the spinous process of C2 as shown here. This is the transverse of C1 as shown here, and then the occiput sits up the top here. And what we find with people is, for any reason, if something called the spinal accessory nerve, which innervates or supplies the nerve supply to the trapezius tendon, if that gets affected in some way, this trapezius tendon, which sits up here in the back of your skull, goes under tension and gets into a small spasm or a major spasm. When that happens, what occurs is this nerve, which passes through the tendon and traverses all the way down here, and it goes underneath this muscle here called the inferior oblique, which is a muscle that sits here. And that's the muscle that's involved in turning the head, like so. What it does, it irritates that nerve, which then causes poor signals to fire back up the nerve root and go back up into the skull via that tendon. And that nerve, that CT nerve root, then turns into the greater occipital nerve. When that fires, it's called a depolarization, and that creates the headaches up here in the skull. And so a headache from the greater occipital nerve will typically be here at the back of the skull and along through here. And in our practice, we have very specific ways of measuring and analysing this part of your spine. And so, for example, one of those techniques is with X-ray, and we can measure using these techniques specific distances and angulation of what's happened between the C1 and the C2. We see this just about every day. I've seen it for 20-something plus years, but we get great results with our analysis and our correction of the upper neck with these headaches caused by the greater occipital nerve.